Hi friends, I'm Dr. Pratap Rathod. I have done in MD in Forensic Medicine, and today we'll continue with general toxicology. In this, we'll discuss about duties of doctor in case of poisoning. Duties of doctor can be divided into medical duty and legal duty. Medical duty is the doctor has to take care of the patient and treat the patient of suspected poisoning cases. This we'll discuss in the next video. In today's video, we'll discuss about mainly about legal duties of the doctor. Among legal duties, the doctor's duty is to assist the police to determine the manner of death in case the person dies or in case if the person alive. So how of manner of poisoning has to be determined helped by the doctor to the police officer. This can be done first by noting the preliminary particulars of the patient. So this includes like the patient when he got symptoms, his age, his sex, his address, those things, and all the things like symptoms when it started to appear, any food, suspected food he has consumed, anything anyone has fed him some food or any items like drink which is suspected to be poisonous. Those things has to be noted down. In case the doctor suspects that it is maybe homicide in nature, that someone has given some poisonous object, doctor must confirm his suspicion before expressing his opinion. This can be done by first obtaining history of route of exposure of that suspected item, quantity of consumed, if anything he has consumed, time elapsed since ingestion, any other person if has same symptoms, any other person if say, to avoid food poisoning, or this all history has to be asked to know whether the any food item is suspected that the person has consumed which has led to poisoning. Then he has to collect everything like vomit and urine from the patient and submit for analysis. The doctor has to observe carefully about and record symptoms in relation to the food. Like if the person, if anything food which any patient relatives brings, has to check whether any suspicious changes in color is there, or change in the taste is there, or some suspicious smell is present, or whether this person is suspicious enough and giving some food, extra food, even though he is not related to, he is giving some food. Any symptoms which appear after he consumes some food in hospital stay also, he may be attempted to commit, some person may try to attempt to kill the person by giving some food, and since symptoms of, if any symptoms are exaggerated, has to also be noted. Then if any person is suspicious, like he is in person is behaving suspiciously by giving some food even though he is already fed, extra food is given, or he is some mixing the food inside the food, like mixing some additional spices, or he is discarding the food after he is fed the food to the patient. So after he giving the food to the patient, he is discarding the food. So all should realize that that person becomes suspicious of homicide poisoning. Then the patient should be kept in hospital as much as possible, or if the patient doesn't is not willing to stay in hospital, he has to be monitored if possible, has to monitor in the home, or he has to confide with the relatives regarding that suspicious person, that there is chance that there may be homicide poisoning attempt maybe that. Once the suspicions are confirmed, he should request the removal of the patient to the hospital, or he should confide among to the relatives, or he has to make the patient uh, give the patient information that there is chance that he may be given some homicide food, food may be given. Any suspected articles of the food, excreta, or stomach wash samples should be preserved. Anything with like full or empty bottles if present, capsules, paper packets, or liquids lying about should be collected and preserved and should for analysis during the case, suspected case which is present at the time of homicide, at the time of poisoning should be collected. Any recent stains on the bird clothes, furniture, etc. should be preserved if possible. So these all things has to be done. So he has to collect all the evidences. If he doesn't collect any information, he is under his doctor is punishable under 238 of BNS. If it is proved that the doctor did not did with the intention of protecting the accused. So if it is proved that he has withheld the information, then the doctor is punishable with according to section 238 of BNS. If a private practitioner is convinced that the patient is suffering from homicide poisoning, he is bound under section 33 of BNSS to inform the police officer or magistrate. So once he suspects the homicide poisoning, he has to inform the relatives as well as next he has to do is to inform the police officer or the magistrate. Non-compliance is punishable under 211 of BNS. If he is sure that patient is suffering from suicide poisoning, he is not bound to inform the patient. Again, this is applicable only in case of private practitioners. So if the patient is if the doctor suspects that not the homicide but by suicidal poisoning, by asking it to the relatives, is close like husband, wife, or daughter, sons, and he confirmed that the person may have committed a suicide by consuming the poison, then he is not bound to inform the patient, not bound to inform the police. But this is applicable only to private practitioners. In the government setup, the doctor has to inform the case of poisoning. Any case of poisoning has to be informed. If the practitioner is summoned by the investigation officer, police officer. So, in cases like any case, if any case of poisoning, if it is land up to the investigation, and the investigation police officer is asked is to the practitioner about case, he is bound to give all the information regarding the case. He has come to notice under section 195 of BNSS. If he conceals the information, he is liable to prosecute under 229 and 239 of BNS. If he gives false information, he is liable to be charged under 212 of BNS. So the doctor has to inform everything to the police, and if he withholds the information, he is punishable. If he gives false information, he is also punishable. A government medical officer, as I mentioned, he is required to report to the police all the cases of suspected poisoning, whether accidental, suicidal, or homicidal, which is comes to the hospital. He has to inform the police. If the condition of the patient is serious, he must arrange the record the dying declaration. If the patient is even after treating the patient, he is not recovering and is about to die, then and if he is willing to give dying declaration, then dying declaration has to be recorded. After the patient dies, body must be kept in mortuary for further investigation, and if the body is released to relatives with before inquest, by any chance doctor can be made to liable for suppression of crime. So doctor has to inform the police once the patient dies. Then if inquest is not done and the patient body is sent to the relatives, then he is liable for punishment. Doctor becomes liable for punishment. A doctor should never grant a cause of death certificate before autopsy is conducted. In case of food poisoning, like if the doctor suspects case of food poisoning based on symptoms like other people are affected by the same food, then public health authority has to be informed so that further investigation can be done. Material objects like stomach wash, vomiters, excreta, blood, urine, etc. obtained from the patient has to be preserved for chemical analysis and kept under safe custody. So everything which is obtained from the patient has to be kept under safe custody so that there is no tampering is done. They should be sent for forensic science laboratory or chemical examining laboratory through constables at the earliest opportunity. So this is the chain of command chain of custody has to be kept so that no tampering is avoided. So doctor should give the constable takes to the laboratory, from the laboratory any information comes to constable to the then sample that comes to the doctor. So this chain of custody has to be maintained. Then all relevant records connected with the poisoning cases must be kept under safe custody and shown to the investigating officer upon demand. So no data should be kept confidential. Everything has to be informed since it's a medical case. The investigating officer, if required, has to be given. No information should be withheld from by the doctor. Everything should be informed. If it is not informed, the doctor will be liable for punishment under BNS. These are my references. Thank you.